Okay, we need to talk about a true medical emergency, one where knowing the signs can literally prevent a life-altering outcome. We're talking about testicular torsion, a really time-sensitive condition that every young man, parent, and coach needs to understand. So let's just dive right in.
So what is actually happening here? Well, testicular torsion is when a testicle twists on its own spermatic cord. That's its lifeline. The best way to picture it is like twisting a garden hose. It kinks up and completely cuts off the flow. Only in this case, that flow is blood. And without blood, the tissue starts to run out of oxygen, which leads to something called ischemia.
And that brings us to the most critical number you're going to hear today: less than 6 hours. That is the window doctors have to get in there surgically and restore blood flow. After that 6-hour mark, the chances of saving the testicle drop dramatically. The tissue can become necrotic, which is just a medical term for it dies, and it's lost for good. You have to remember this. Time is tissue.
Okay, so we know how urgent this is, but how would you even recognize it? Let's get into the warning signs and what this actually looks and feels like from the patient's perspective.
The single most defining feature, the #1 giveaway, is the pain. And this quote just captures it perfectly. We are not talking about a dull ache that kind of builds up over time. No, this is a thunderclap, an abrupt, incredibly severe onset of pain in the scrotum that is absolutely impossible to ignore.
And along with that intense pain, there are several other key symptoms. The body's reaction to pain that severe often includes nausea and vomiting. You'll also see physical changes right away. The scrotum gets swollen and is extremely tender to the touch. And because that cord is twisted and shortened, the affected testicle might look like it's riding higher than the other one. Sometimes it can even be lying sideways, horizontally, instead of vertically. These are all huge, huge red flags.
Now, who is most at risk here? While wall torsion can technically happen at any age, you can see this massive peak during adolescence, usually between the ages of 12 and 18. This is exactly why it's so vital for teenagers, their parents, and especially school coaches to know these signs cold.
So you've recognized the signs. You've made it to the emergency room. What happens now? Let's switch gears and look at the clinical side of things. How a doctor actually figures out what's going on.
One of the first and most reliable clues a doctor looks for is something called the cremasteric reflex. Okay, what is that? Normally, if you gently stroke the inner thigh, the testicle on that same side will pull upwards. It's an automatic reflex. But in a case of torsion, that reflex is almost always gone. It's a really sensitive sign that something is seriously wrong with the nerves and blood supply in that cord. Here's another critical diagnostic test called the Pren's sign. This is huge for telling the difference between torsion and something like an infection. With an infection, if you gently lift the scrotum, it might actually relieve some of the pain. But with torsion? Nope. Lifting it provides zero relief, and sometimes it can even make the pain worse. This simple little test points straight towards torsion. And this brings us to a super important point. The diagnosis is what we call clinical. It's based on the patient's story and the physical exam. If a doctor has a high suspicion of torsion, they are not going to wait around for an ultrasound. Every single minute counts, and delaying for a scan can be the difference between saving and losing that testicle. The immediate next step is a phone call to a urology specialist, period.
Now for some good news. As scary as this emergency is, there is a very clear, urgent, and definitive solution. So let's walk through the path to treatment.
The protocol is really straightforward. First, an immediate surgical consult is called. While waiting for the operating room, a trained doctor might try what's called a manual detorsion, gently untwisting the testicle from the outside. But listen, that's just a temporary fix, kind of like a bridge to get to the final, necessary step, surgery.
So the surgery itself has two main goals. The first is detorsion. The surgeon goes in, looks at the cord, and untwists it, which restores that precious blood flow. The second, and just as important goal, is called an orchiopexy. This is where the surgeon actually stitches the testicle to the scrotal wall to make sure it can never, ever twist again.
And this is a really important detail you might be wondering about. The orchiopexy, that stitching procedure, is almost always done on both sides. Why? Well, the anatomical issue that allows one testicle to twist in the first place often exists on the other side too. So to prevent another emergency down the road, the surgeon will secure the unaffected testicle at the same time.
We have covered a lot of ground very, very quickly.
So let's wrap this up by boiling it all down to the most essential, life-saving takeaways. This is the stuff you absolutely need to remember.
Let's run through a quick mental checklist. If you see a teenager with a sudden, severe onset of scrotal pain, if that pain doesn't get any better when the area is lifted, and if you notice that testicle is riding high or lying sideways, you have to suspect torsion. These are the life-saving clues. And if that checklist is pointing to torsion, the single most important action is this: do not wait. Do not hope it gets better. Get to an emergency room immediately for an urgent urology consult. That's the bottom line.
So we'll end with this question. What you've just learned isn't just some random medical trivia. It's knowledge that can prevent a permanent life-altering outcome. So now when every single minute counts, would you recognize the science? After this, your answer should be a confident yes.